delegates, dignitaries, and distinguished colleagues, on behalf of the Department of Psychiatry, Pratima Institute of Medical Sciences, and Karimnagar Psychiatric Society, it is with great pleasure I extend a warm welcome to each and every one of you to the 9th Annual Postgraduate CPD of Indian Psychiatric Society, Telangana State Branch, focusing on research capacity building for psychiatry residents. This CPD serves as a platform for us to delve into the unexplored and uncharted areas of psychiatry research, research protocols, paper presentations, journal submissions by exchanging insightful perspectives and forge meaningful connections within the realm of mental health. Over the next few hours, our agenda is packed with thought-provoking, engaging sessions and opportunities for networking. I encourage each and every one of you to actively participate, share your expertise and cultivate new ideas that will shape the future of psychiatry. Without any further ado, let's start the scientific journey with our first session on how to get your first paper published in a journal by Dr. Shahul Amin sir. It's my distinct privilege to introduce to you our esteemed chairpersons, Dr. Mina Jafar Nasirabadi sir and Dr. K.K. Lakshman sir for this session. Firstly, I have the honor of welcoming Dr. Mina Jafar Nasirabadi sir, Professor and Head, Department of Psychiatry, Deccan Medical College, Hyderabad. President, Indian Psychiatric Society, Telangana State Branch, Assistant Journal Secretary, Indian Psychiatric Society, Honorable Secretary, Indian Medical Association, Hyderabad City Branch, Editor, Telangana Journal of Indian Medical Association, Past Joint Secretary and Scientific Committee Chairman, Indian Medical Association, Hyderabad City Branch, Co-Chairperson, History and Psychiatry, Task Force, Indian Psychiatric Society. Now I would like to give a warm welcome to Dr. K.K. Lakshman sir, President, Karimnagar Psychiatric Society, former Superintendent, District Hospital, Karimnagar. I may now pass the baton to our esteemed chairpersons, inviting them to graciously introduce our esteemed speaker and offer their...
How to get your first paper published in a journal. I remember... I welcome Dr. Shahul Amin. Welcome, sir. Was not published or it was never documented things. In India, we do lots of things which are not documented, and I think we need to publish what we do, document what we do, and thus the work which is done by our Indian psychiatrists, I think we do lots more than the Western people, but we don't publish, we don't do research or we don't publish. So we were doing Faraday stimulation to people of hysterical aphonia. So we used to apply Faraday stimulation current on neck area to the patient with hysterical aphonia, and sir said we searched all the journals available. Those days internet was not there and we couldn't find anything. We were doing that in Sion Hospital where I did my PG since last maybe before that, before 2002, maybe around 20 years we were doing that Faraday stimulation, but it was never documented. So first was my case report on Faraday stimulation in case hysterical aphonia in Indian Journal of Psychiatry. That was long back in 2002. So I think Dr. Shahul Amin will show us the way, show the new PGs how to publish their first paper. I would request Dr. Lakshman sir to introduce the speaker.
PGCPD for giving this opportunity. Especially Dr. Kishan Porandla Garu, organizing chairman, and organizing Dr. Sai Krishna Pudi. I'd like to introduce today's speaker, Dr. Shaul Hameen, consultant psychiatrist in St. Thomas Hospital, Chenganacheri, Kerala, and immediate past editor, Indian Journal Psychiatry, Indian Journal of Psychological Medicine, now Chairman Research Capacity Building Chairman, Capacity Building Committee, IPS South Zone. Now I request our speaker to present his presentation.
Good morning, everyone. This is audible. This is working. Oh, no. Now? Yeah, okay, thank you. So, good morning, everyone. At the outset, I would like to thank the organizers both for giving me this opportunity and also, more importantly, for choosing research as their sole theme for an entire PG training program. Usually, when we have PG training programs, we focus on exam-related topics, how to read a CT, how to read an EEG, things like that. And even if there is a presentation on research, that is given only some kind of lip service. So, it is a very commendable effort. I thank Dr. Sai, Kishan sir, Minhaj, etc. for taking this bold step. So, coming to my topic, the PGs here, anybody of you have already at least submitted any article, at least a case report to any journal, anyone here? It's absolutely okay, nothing to be ashamed about. Okay, there is nobody, so it is going to be, yes, one person is there, very good. So, this is how we will be learning the basics in this presentation, I hope. So, my slides will be shared in your WhatsApp group after my presentation, so there is no need to keep clicking the slides and all, the entire thing will be sent to you by Dr. Sai later. So, let me start with the most important question, why publish? It is a truth that most of us don't like going through the hassles of publishing, submitting, getting reviewed, replying to that, getting rejected and all, no? Unless it is absolutely essential, we keep postponing that, maybe the way we postpone a root canal and or something. When the promotion is very due or something, then maybe in a haste we start preparing the article. This is the reality, but it need not be so. Why you should have some articles in your name? One is obviously to improve the CV, because all of you know that the PG seats are increasing every year. It is going to be a highly competitive world. So, to put yourself ahead of others in the race, it is better if you have a better CV with some publications in some standard journals. That is clear. Then you know that for promotions, when you want to be in the teaching field, assistant, associate, professor, everywhere they ask for publications. Even now NMC says you have to at least have some submission or maybe one poster presented and things like that. So, there are some compulsions on you to have some publications, that is another thing. But I won't give a lot of importance to these. One more important aspect I feel to increase the knowledge. Once you publish, once you do a research, there are a lot of things that you learn. How to search for literature, how to synthesize the literature in your mind, how to critically evaluate the literature, how to collect the data, how to do the analysis, how to do the write-up, how to go through the peer review process. So, that is a different kind of knowledge compared to your MSc history, schizophrenia, bipolar, that kind of thing. And especially when you are going to be in the teaching, you should have some experience, so that only then you can guide your students. So, that is very important if you have that kind of an aptitude. And much more importantly, there is a satisfaction in contributing to the field. What you are doing now is you are passively taking the information that is there in the textbook, journals and all. It need not be so. You can be a part of the knowledge generating team, right? You can have your own findings, your own views, your own case reports that your fellow psychiatrists and fellow researchers and even the policy makers, the public, everybody can use that information. That gives you a good sense of mastery at the end, right? For example, Dr. Dennis will be speaking to you. I think next session is his. This is his Google Scholar page. The kind of research he has done, if you look at it, just one number. The number his articles have been cited is nearly 2 lakh. So nearly 2 lakh sets of authors have used his material, maybe when they were developing a case for their study, when they were developing the methodology of their study, or when they were discussing the findings of their study, his articles have been depended upon 2 lakh times. That is not a small thing. That gives you some pleasure that that's a life worth lived, right? So it is not very boring. It is a very highly rewarding field, the field of medical research. And not only that, once you have some publications, especially in a niche field, you will be considered the expert in that field by everyone. Fellow psychiatrists, the public, the media, the policy makers, the journal editors. Whenever you have 2-3 publications in an area, I am sure that editors like Rajshekhar and Sujit will send you an article. When they have another paper on that topic, they will know you have published on that. It will be given to you for peer review. You are the one who will make the decision whether it will be published or not. For example, in this news, you can see that one person in Trivandrum died of suicide because of his online gambling addiction. And when the Indian Express reported that news, they contacted Dr. Sanju, who is a psychiatrist working in Cochin, for his comments, because he has quite a few publications on online gambling and addiction and all. So that is the kind of benefit, the kind of exposure, the position that you get when you have some good papers, especially in one niche domain. Now, especially for PG students, it may not be possible to get a lot of outstanding studies published and all, because of lack of time, lack of resources, lack of funding, lack of expertise and all. That is agreed. Except for your thesis, you may not be able to do a lot of other research, at least in the PG phase. But one huge resource that we have in all Indian states is that we have loads and loads of patients. And that Dr. Minhas told about his patient with dysphonia. All of you will be seeing very interesting cases. So it is better to start with case reports. One thing is, there are plenty of patients. If you look closely, there will be something new about the comorbidity, about the symptom, about the way you treated it, the prognosis, the investigation findings. Some novelty will be there at least in some patients. So you prepare case reports and start submitting them. That will also help you to get a taste of the process. Like when you have finished your thesis and you have prepared a research paper, and that is the first time you are dealing with a journal, it may not be that easy. But to get how the submission process works, how the peer review works, how the editors work and all, for that if you have some case reports, submissions and publications beforehand, you will be prepared for more serious research papers. So that is one thing. I will show you 2 examples from my own PG days. It was the era of citalopram, before citalopram. We gave that to a person, a child actually, who had some pseudo seizures along with the seizures, and we gave citalopram, and he had a manic switch. So my SR told me to prepare a case report, and we were able to get it published in New Zealand Journal of Psychiatry. And in another case, we had a patient who had chronic mania that was caused by electrocution. And when we did the EEG, there was diffuse slowing, and we treated him with sodium valproate, the mania improved, and later when we checked the EEG, the slowing has also improved. So we were able to get that published in bipolar disorders, both good international journals. So I am sure that each of the PG sitting here will be able to do this. If you look closely at your patients, there will be something novel about at least some of them. You will be able to get at least 3-4 good case reports published in some good journals. So whenever you have a case, you feel that something is different about this case, you go to at least these 2 sources, PubMed and Google Scholar, and see whether similar cases have been reported. Even if similar cases have been there, your case will be different at least in some aspect. At least that it may be the first Indian case at least. Even otherwise, age-wise or gender-wise, or maybe the kind of treatment given, illness duration, some other differences will be there that you can highlight to say that this is a new, novel kind of a case. So you can do that. There are 2 tools you can use when you are writing, submitting case reports. One is this care checklist. So what you can do is, if it is freely available in the internet. So whenever you are preparing, you ensure that all the items mentioned here, whatever is relevant, it is mentioned in your article, so that the peer reviewers do not have to point out that you did not mention this. That will make the reporting part of it complete. Also, suppose you are talking about the adverse effect of any medication, this Naranjo algorithm is very useful tool. You can give a rating, like whether this is induced by citalopram, whether this is induced by valproate. For that, if you add the scores, you can say whether it is doubtful, whether it is probable, whether it is possible, whether it is definite, things like that. So all this helps to assess the strength of the like etiological relationship between the medicine and the effect that you are reporting. So these two tools you should be familiar with when you are reporting case reports. Now moving on to research papers. In research papers, many people complain that editors keep on like rejecting my paper, rejecting my paper. The most important thing we should remember is that the editors are looking for novelty. That is the first thing in any good journal. Your study should be such that it advances the field at least to some extent. It should have some superiority to whatever studies are already there, be it in terms of sample size, be it in terms of duration of follow, be it in terms of the tools used, whatever. If it is absolutely not novel, no good journalist is going to be interested in that. There is no point in blaming the editors for that. But what usually happens in most centers is that we have a certain set of fixed variables, quality of life, burden, disability, caregiver stress, right? Then we have the common kinds of conditions that we see in our OP, schizophrenia, bipolar, depression, alcoholism, OCD, right? Then it is all the permutation combination. One person does QOL in schizophrenia, other one does burden in bipolar, the next year it changes. That is all. Again the same thing again and again and again, and then you complain that no journal is accepting this. Nobody is going to do that, because this has been, when I was a PhD 20 years ago, again even then this was old. So you can do this, you can get your MD, but you don't expect to get published in any good journal with a topic like this. So the novelty part is very important. So other very commonly, like very repeatedly published, so redundant studies, very repeatedly submitted and rejected topics include internet addiction in medical students. When I was an editor, at least once a week I used to get one article on this topic that I immediately, after reading the title itself, I will reject. I will not even read the paper. COVID-19 induced stress, burnouts, that, this and all. Even now I am sure, even after 4 years, we are still getting submissions on like COVID related stress and all. So these have become old by now. Depression in various medical conditions, especially if you are using some screening tool, absolutely no novelty. Almost every condition, enough systematic reviews and meta-analysis are there. So these kind of topics better stay away if you want to get published in good journals. So when you have your topic ready, you go through again these two databases, whether studies have been done on these topics already. If there are lots of studies, you can still do, provided you have some superiority. Like you can add something to that. You go through the limitation sections of those papers, and then if you can like work upon some of those limitations, then you have a chance. This is I already told, the future direction sections of appropriate articles. So there they would have mentioned the future researchers can do this, do that. So you can do that, and you can cite in your article that okay, this particular article told to look upon this, so that is why we are studying this. So that gives you an edge with the editors. Now as in the rest of life, this is a very useful dictum. Work smarter, not harder. Right, all of you are familiar with it, and that is very good also. So here what I mean is, like I told you that it has to be novel. But when you are studying quality of life in schizophrenia, it is going to be very difficult to be novel, right? Novelty is relative. Whatever has been already done in that topic, so yours should be better than that. But suppose the construct itself is novel, then whatever you do is novel. Right, I will give you some examples. When I was an SR in Central Institute of Psychiatry, Ranchi, one of my junior residents who was doing his post-DPM MD, Dr. Sadicha Sahu, he came to me and told that let us do a study, because that was that time the risperidone and olanzapine came just 2-3 years before that. So he told me let us do a study whether these agents cause metabolic syndrome or not. But I told, but there are lots of reports already that each of these agents cause diabetes, dyslipidemia, weight gain, all reports are there, why do you want to do a study? Then he told me that a new definition of metabolic syndrome has just been published the month before that. So it has been just published, it is very new. So it is unlikely that anybody has done a study on that. So if we start fast, if we do the study fast, we can be sure that we will get published in some good journal. So that made me change my mind. He had a point there. We did the study and we were able to get it published in Schizophrenia Research, one of the most prominent journals in psychiatry, right? Not only that, that article has more than like 170 citations, including a citation from the coveted Maudsley guidelines. So that is what, when you have to keep on the lookout for what is new in the field. Then you do studies on that, so you have a much higher chance than doing studies on all these many times repeated topics. Earlier I told you that COVID, that is a very old topic now, but it was not so in the beginning. Like COVID became known to us, most of us in March 2020, that kind of thing. But whenever it started, that time itself people started doing studies. And in the July issue of IJPM, we had 3 papers about COVID-induced stress. 3 papers. But that was new then and it was very important then. But within 2 months that got its novelty. This is one of the papers we published that time and it had loads of citations. For many 1 to 2 years, it was the most cited paper in IJPM. That time it had 68. It is for the last 3 years, but because of that now it is removed from the list. So whenever anything new, again like when MSCA came, there were many people who did some studies on what is the perception of psychiatrists about ECT, what is the perception of public about advanced detective and all of them got published. That is what, keep on looking out for the new things. Now AI is coming. So you can do whatever, most likely, whatever you do, any relevant topic related to AI that you do a study now and submit within 6 months, the chances are very high that it will get published in good journals. So this is one tip. Keep looking out for new ideas, paradigms that are there out there. Now some of the formalities that all the journals will insist on if you want to get published. One is obviously ethics approval. Previously it was not like that, but now every good journal mandates that all articles, research articles published should have an ethics approval, or even if it is a waiver, the waiver should come from the ethics committee, not you cannot decide that we don't need an approval. Many a time the thesis and all we get the ethics approval, but the small studies that we do maybe for ANSIPs and things like that, we usually don't bother to get ethics approval. But don't do that, good journals are not going to consider those articles, always get ethics approval. And if it is an intervention study, any kind of intervention, you are studying the effectiveness of anything, don't forget to register in CTRI. It is very bad actually, in IJPM only very rarely we used to get intervention studies, so we want intervention studies, they are more useful. But 95% of them were not registered in CTRI, so we have to reject them. So ensure that, and whenever it is an intervention study, if it is not in CTRI, you are wasting your and your patients, everyone's times and efforts. This is the CTRI website. Now when you are writing the research paper, I told you earlier about the care checklist for case reports. This website, this Equator Network website has checklists for all sorts of studies, observational studies, qualitative studies, intervention studies, everything. So whenever you are writing, you ensure that whatever those checklists asks you to put in the article, you put that. Even some journals like IJPM asks you to submit the checklist also. Even if the journal is not asking for that, it is better. If your reporting is complete, the reviewer will have less criticisms to make about your article because you have already put the necessary information. So always use the checklist and compare your write-up to ensure that you are including all the important information. Now many a time when we go submit to international journals, the usual complaint that they make is that the language is not sufficient. And most of us are not native English speakers and we are trained in maybe Andhra school, Telugu school, Malayalam school and all. We are not from English medium schools also, most of them. So our language may not be that good. So but maybe 10-15 years ago it was more of a problem, but there are various tools that you can use to improve your language, especially if you are submitting to international journals, because without clarity, how can people understand what you did and what you found and all? The language has to be, it need not be poetic, not like a novel, but the clarity part should be there. The people should be easily able to understand what you actually did. So Grammarly, I think most of you will be knowing by now, even the free version has a lot of options. They will give you a lot of suggestions about what all corrections you can make, use at least that one. Then there are some paid services from some of the major publishers. Editage is from Wolters Kluwer, Sage Miles is from Sage. You have to pay them an amount, I don't know how much, but if you give them the article, the final article, they will modify it accordingly and make it the language, grammar, paragraph, syntax, everything correct and appropriate to submission to a journal. And that is ethical. There is nothing unethical about that. And you have to acknowledge that in your article that the language editing was done by such and such agency. That is all. I have a YouTube channel in which I had uploaded some videos about how you can use better language in your articles. Research workshop, you can get that link from the slides that will be shared with you. Now this is another very useful tool from PubSure. There what you can do is you can upload your article. So they will give you a lot of feedback. They have a free version, they have a paid version also. Free version is mostly sufficient. For example, this is one article I uploaded. They told there are 227 errors. Not all suggestions are valid. You have to screen each of them and make sure yourself. but you can get at least some good suggestions about some errors in language, grammar, punctuation and all, and you can correct them. And it has other options also. For example, it will point out old references. In my article, it said one of my references is from 2002. You better use some newer reference. So these kind of suggestions this tool gives. It is AI based. So that is a very useful tool, PubSure. And the free option is good enough. And also, if you haven't cited any of your tables or figures in the main text, it will point out that also. So before submitting, if you run your article through this tool, a lot of improvements you can make to the article on your own. Now again, this is the ChatGPT era. If you talk about that, it will be a topic in itself. But one thing is, if you are asking, say you have a topic, you are studying, suppose a metabolic syndrome in schizophrenia, and you ask ChatGPT, this is my topic, you please write an introduction for me. That is not well. That is not good. The thing is that I told in the beginning, you gain the knowledge. That does not happen. You have to search the literature, you have to synthesize the information, only then you will have the knowledge, only then you can write a proper discussion also, that is one thing. Other thing is you will be caught, because there are tools, though they are not very perfect, that can identify text that is wholly generated by AI and all, that is one thing. At the same time, once you have prepared your article, you can ask ChatGPT, like you please correct the language, grammar and punctuation, something like that, and if it gives you in return a polished text, that is absolutely okay. Only there are two things that you have to be careful about. One is you have to acknowledge. You have to acknowledge that ChatGPT was used for language checking, that you have to mention in the acknowledgement section. Then you have to read it thoroughly, because that is a machine anyway. So whatever output it has given you, you should not be simply copy pasting that. You should go through it and correct errors if there are any, otherwise you are going to be in trouble. Now how to choose a journal, that is very important. When you want to get published, if you submit to the appropriate journal, the publishing time will be fast, the chance of acceptance is more and more. So how to do that? The first question that you have to ask yourself is to submit to a general journal or a specialized journal. For example, we have journals like Canadian Journal of Psychiatry, Asian Journal of Psychiatry, that covers the entire psychiatry, everything related to psychiatry. So the question you have to ask is the message your article has, whether that is relevant to all psychiatrists or whether that is relevant to only to some people working in a very small niche area, depending on that. Suppose you feel it is relevant for all psychiatrists, you can submit to a journal like this, a general journal that covers the entire psychiatry. Or we also have highly specialized journals like child and adolescent psychopharmacology, cyber psychology, behavior and social networking, very, very focused areas. So if you feel that your article will be of interest only to those who are dealing with the children or adolescents and giving them medicines, then you better submit to this journal. Your chance of acceptance will be more. Only one issue is these kind of journals, they are published less frequently, once in 4 months, once in 6 months and all. Well, other journals, most of them are monthly. So it is like faster you can end up in an issue. That is one thing. Here is an example. Some of my friends from Kerala did a study, prevalence of child abuse in Kerala. And it got published in a journal called Child Abuse and Neglect, right? So if you match your article with the journal so perfectly, because a journal like that will love to have one study from India, because they want to have a global representation and all. So if you match your topic with a journal like this, you can end up with very good journals. Now also about the geographical focus. Who is likely to be interested in your article? The entire world, or maybe only people in one continent, or only people in India, or only people in Telangana. Depending on that also you can choose your journal, international, continental, national, state. If you feel for the entire world, go for international journal. If you feel it is only like a validation of a Telugu version of one rating scale and all, maybe you can submit to the state journal, absolutely okay, because AJP or BJP are not going to be interested in such an article. Okay. So you see like who will be benefited, who will be interested, depending on the readers of each journal, then you choose like the corresponding journal. Now there are some online journal suggesters, journal selectors which you can use. They are very useful tools. Like you have to paste the title or abstract there and you do a search and they will give you a list of journals. So some of them will be a very good suggestion. This is a free tool, Jane, Journal Author Name Estimator. If like I did a search for olanzapine and metabolic syndrome and it gave me this list. Schizophrenia research, neuropsychiatric disease and treatment, ACTA, Journal of Psychiatric Practice. So you get a lot of other information also, where it is indexed, what is the article influence score, that is a quality score, And if you want to see some articles published in that journal, you can just click that show articles button and all. A very useful tool. You can try this one. This is another similar tool, Advanced Journal Selector. Then this is one from Clarivate. This is a new one. Again, you post the title, you abstract, you find journals. So you will have like articles that are indexed with the Clarivate. So they will be a better quality journals if you like search in this one. Though it may be difficult to get accepted, that is different matter. But you will have better quality journals here. Now each of the major publishers have their own journal suggesters. But the thing is, if you search, the results will be limited to journals published by them, not by others. So if you want, you can try. It is there from Elsevier, Wiley, Sage, Springer. All of them have their own journal suggesters. You can use any of these tools. Now this is very important. Before submitting, you have to ensure that your article is within the aims and scope of that particular journal. The most common reason for rejection by journals is not the poor quality of your article. It is the mismatch between the aims and scope of that journal and the topic of your article. For example, IJPM. IJPM, the name is Journal of Psychological Medicine. But that is because IJP was already there. So I think whosoever chose the name chose psychological medicine. It does not have much to do with psychology. But many a time people submit articles that are of core psychology topics, emotion, affect, which are of absolutely no clinical relevance. So we reject that. So that is because they haven't looked what we are looking for. What is the aims and scope of this journal? That is the problem. So like simply based on the name, you don't decide. You go to the journal website, you see the aims and scope. Not only that, you go through some of the recent issues the journal has published. So that way you will get to know what kind of articles, the level of quality, the kind of topics the current editorial team likes. So if your article is matching that, then it is better that you submit to one of those journals. Now another issue is that many a time people don't want to go through all these hassles, writing and especially undergoing peer review and all. So all of them know if you pay 3,000 rupees, 4,000 rupees, there are journals that will publish within 2-3 days and you will get the certificate and you get your promotion and all. That is an easy route, but that is a very dangerous, unfortunate route because it is a record. It is a record. Your future students, especially those who you will be guiding and all, they will know that you yourself got published in a journal like that. Your future employers will know that this is how you got your promotion, this is how you do your research and all. And if it is published in a predatory journal, nobody is going to read that, nobody is going to cite that because everybody knows it is not peer reviewed. It is not going to get any value, especially if you have done the study seriously, if you have put some passion into it, it is going into waste. In a workshop in Nimhans, one speaker told, it is like preparing a biryani with spending a lot of time and a lot of effort and a lot of passion and then putting it into the dustbin without giving it to anyone. That is what you are doing when you are publishing in one of these predatory journals. So don't go for that. It has a lot of repercussions. Even it may be removed from the whatever indexing agency, UGC Care or PubMed and all, then you will be in a soup. In your promotion and all will be at stake. So better don't take this easy route. So how to recognize? There are many people who don't know basically. They don't know. Only after the people start asking for huge amounts of money, then they, oh, is it like that? Then they are not even able to take their articles back also. So how to recognize whether it is a predatory journal or not? It is not very easy, to be honest. They are getting very clever year by year. Many a time it is very difficult to distinguish whether it is a genuine journal or a predatory journal, but there are some indications. One is a very wide scope of interest. It will cover everything. Though there are genuine journals like Nature, Science and all that cover all specialties, right? But it is very rare and they are very standard journals. But these predatory journals, their scope will be very wide. For example, this is one journal. I will read only some of the parts. Accountancy, agriculture, anthropology, anatomy, architecture, arts, then till statistics, tourism, veterinary science, animal husbandry, yoga, zoology. So it is almost everything under the sun. So what that means is they want money from everyone, that is all. They have absolutely no focus, nothing. That is one clue. On the contrast you see, this is Social New Zealand Journal of Psychiatry, what they want? Original articles which describe research or report opinions of interest to psychiatrists, that is all. That is the aims and scope. That is very focused, highly focused. So this is how a good proper journals scope looks. Also if you look at the home page, what you can see is there is one button there, submit paper, otherwise what is the impact factor, how you can access all the issues, where is the current issue, what are the old and first articles, which are the most read articles, which are the most cited articles. So these are all like tuned toward the reader, right? Like when a reader is coming, what all information a reader should find. That kind of information is prominent in the home page. In contrast, in a predatory journal website, it will be more to the submitters. It will not be to the readers. Like in what time you can get it published, you will get a certificate, you will get a hard copy. That information will be given more prominently. And also another thing is, that is what I already told, it will be targeting the authors. And they will not have any proper manuscript management system and all. Mostly they will ask you to send it by email, and mostly that will be Gmail and all, not even the domain of the journal. For example, that particular journal, they have given 2 Gmail addresses, so that anytime they can delete the address and run away. You will not be even able to trace who was at the other end. Obvious typos, spelling errors, grammatical errors in the website, because these are not run by professionals or researchers. These are run by charlatans who just want your money. So there will be all sorts of errors. And they promise us publishing in a few hours or weeks. They may have listed fictional researchers as editors. Like in the editorial team, you can see that there are various people involved, but they may not be even aware of that. Many people have faced that issue. Their name is there in a website like that, and it is very difficult to get the name removed from there. And also even those people may not be even existing also. If you search those names in Google Scholar or PubMed, you will not find anyone. So just for namesake, they type some name and put there as editor, associate editor and all. All these things can happen. And all of you know, if you have published at least one article, they will keep on sending you emails. We are going to publish one issue, you please submit your article to us. These kind of unsolicited emails are very prevalent from predatory journals. And they may claim that they are in PubMed's corpus and all, when they aren't. But you should not believe their claims, the claims of any journal for that matter. You go to PubMed, you go to Scopus and search and ensure that the journal is there. Any journal's claim you don't believe. Again, about this also some videos are there in my YouTube channel. Those who are interested, you can watch it there. Briefly about the ethics of publishing. Like again, this is a very common practice. When a PG student is publishing a case report, he or she would like to impress the entire department. So everybody is made an author. From the HOD to all the associate, assistant, SR, everybody. You want to make everybody happy. Otherwise, they may get angry also. Right? But that is not right. There are certain criteria that you have to follow. Who should be an author, who should not be an author and all. The criteria is that the person should have made substantial contribution either to the concept or design of the work. The person gave you the idea about the methodology and all, that part has to be there, or helped with the data collection, analysis or interpretation, writing and all. So either of these areas the person should have contributed. And the person should have either written the work or helped revising it. The person has gone through your write-up and made some suggestions about how to improve that. For intellectual content, not just punctuation, comma, things like that. And final approval of the version to be published. All the authors should have seen the final version and they have approved, okay, this can be published in my name. It has to be there. And they should be ready to take the responsibility for the entire article. Once it is published and there is some issue, they cannot say that, no, that part I didn't see, that was done by that person, not by me. They cannot do that. So only then somebody can be an author. And even for senior people, it is very dangerous just to be agree to be an author in something that you are not involved in. We have had some very huge issues. Recently, we retracted an article from Kerala Journal of Psychiatry simply because that PG student, what she did was, she copy pasted information from one nursing thesis. It was submitted to Kerala Journal, it was published. Now after about 5-6 years, that nurse found it out. He complained. We had a lot of meetings and all. Now it is retracted. And now the HOD, everybody is in a soup, all of them are co-authors, they did not even know that this has happened. It is like in their, whenever somebody searches in their name, it will also be seen that this person was involved in this plagiarism job. So seniors also should be very careful about what the PGs are doing. This is about a copy-paste job and all. Never go for plagiarism. It is very easy in these days to do, but never do that, even that can have very serious repercussions. This is again from one that happened some years ago. Like one psychiatry department in South India only. They published an article in IJP. Later someone pointed out that just one paragraph was copy pasted from Wikipedia. So somebody pointed that out. IJP retracted that. But we may think that it is very simple matter. The news came in the Hindu with the name of the authors, name of the department. See that. Simply for copy pasting one paragraph from Wikipedia. So these are not simple matters. It can be ill fame, especially for PGs. Whenever your employer searches and your name and finds a news report like this, you are done. Right. So don't go to this kind of tactics. So how to prevent ethical issues, especially plagiarism problems? Never quote others without putting the material in quotation marks and giving a correct citation. If you are directly picking some text somewhere, you put it in quotes and give the citation also. Whenever you are using the words of others, some idea is not yours, it is of somebody else. Even if you are paraphrasing, you give a citation to the person who originally said the idea. Never use material from tables or figures, even not only from the text, the tables, figures of other people, you have to give the citation. And not only citation is enough. If you are using certain kind of material, you have to get the permission from the original authors. For example, you are using some tables from some other articles, using some figures from some other articles, photographs, very long quotations. For all these, you contact the original author, get the permission, I want to reproduce in my article whether it is okay. Only when you have such proof, you should be including them. Submission, when you are, this is the presentation time or discussion time is also included in that? 5 minutes?
Discussion time is also included.
I think then I will stop here, we will have take some questions.
2-3 minutes. Yeah.
Okay, okay. When you are submitting, there will be two types of files, that is it. Because mostly it is anonymized peer review. The reviewer should not know who you are, from which center you are and all. So for that, there will be two different kinds of files. One is called title page or first page file, depending on the publisher. It is in that page you put all the identifiable information, your name, your institute's name, the acknowledgements, the ethics committee number and all. None of this should go in the main manuscript file, because the reviewer should not be able to see all that. That is one thing. Then when there is peer review, I won't go into the details what happens when you submit a journal. The editor will do a screening. If there are some deficits that need to be corrected, it will be sent back to you. Then you again submit it. Then after that, it will be sent to 2-3 peer reviewers who will assess your article, whether it should be accepted, whether it should be rejected, whether it should be modified. These kind of recommendations they will give to the editor. Then the editor will pass on that information to you. If it is rewriting, you have to again rewrite and again give to the editor. It will again go to the reviewer. Then the reviewer will say, now it can be accepted. That is how the peer review system works. I will not go into the details. But one important thing is, when you are responding to the reviewers, especially if it is a revision, when you are responding to the reviewers, first you should thank them. Not many people do that, because a reviewer spends hours assessing your article and giving you feedback. So start with, this is one of my own replies to reviewers. I sincerely thank both the reviewers for their prompt informative feedback, comments and suggestions, and like that. Then you have to list each of their comments, reviewer 1, comment 1, reviewer 2, comment 1, and you have to give your replies. This is how I have modified. You need not blindly follow all of their suggestions. You can argue also. This is why I am not making. For example, they asked me to remove tables 3, 5, 6, 7. I told I removed tables 1 and 3 with explanation. This kind of freedom you have. The editors, the reviewers will be able to understand that, because it will be going to be published in your name, not their name. So you have the right to make it best. You have the right to differ with them with the respect. Finally, some suggested resources that you can use to improve your research skills. This is a book published by IPS, the second edition. I am one of the editors. It has all the aspects, from data collection to analysis to publishing, everything. It is from a psychiatry perspective. You can buy that from Amazon or other websites. Then this group, if you are not a member, E-Journal Club India, that is a Google group, free, run by Dr. Chittaranjan Andrade from NIMHANS. A lot of discussion happens, a lot of articles are analyzed. You will learn a lot from that group. Then in the IJPM, there is one column, Learning Curve by Andrade sir. In the past 3-4 years, it has been there. A lot of useful articles, very lucid language. You can understand a lot of information from his columns. Then our South Zone has this BCPR, Brief Course in Psychiatry Research. This is the 4th year. Kishan sir was instrumental in starting that, in raising funds for it and all. So this year we have this complete, the seats are full. Maybe next year after that, if you want to be there, Dr. Sanjay was there in the first batch. So you can join that. It is a very comprehensive course covering all aspects of research, from data, finding the idea to publication and presentation and all. That's all. Thank you.
Thank you, Shahul. It was wonderful. It was useful. I think it was not only useful for PGs but also to teachers like us. Thanks a lot for your wonderful presentation. I would request 1 or 2 questions from the audience.
What?
Any questions from the audience? Ashok Reddy sir.
I think it's mainly for postgraduates who are supposed to raise the questions, because the training program is meant for them. since they are not raising the questions, I'll take this time as a PG teacher. I'm raising the question. One thing, our honorable editor, we appreciate your lot of service to the society in terms of publication of journal. You have served the society a lot. We are thankful to you and also thankful for present in today's session also, which enables the PGs for publication. One thing is, when the article is received by the editor, one thing is you may screen, you will send to the reviewers, come back, and then you may reject and keep quiet. But do you have even enabling role also, like, do you suggest them that we can present this to another journal? Is this done? The enabling activity of editor also, is it done or not? That's one.
That is currently not done because of the workload that we have.
Right.
Because there are so many submissions, so it will be difficult.
But that is a welcome thing. If you can just say, this is not suitable journal, probably you can suggest, because PGs may not know which other journals are available. Probably that can be help them for publication. That's one thing.
Now, if an article has gone for peer review, anyway, they will get the peer reviewer comments. But
Right.
if you are rejecting without any peer review,
Right.
we usually don't mention. Because initially I used to give some comments. These are the problems. Then they will start arguing also.
Right.
So because of that, we stopped that.
Right. Okay. Second thing is, for the editors, is a more like technical job in the society. Unlike secretary and the president, are there any training courses even given to the editor to make their job more perfect? So that whenever any person contests with the editor post, there should be some qualifications required for that. That's what I wanted to know.
No, there are some books available. That is one thing. Now, last year IJP had a meeting of all the editors.
Right.
Now, IJP has some plans
Right.
to, like, even now I am in the international research collaboration consortium. So, what we are doing, planning is, I am not
Right.
very sure,
Right.
like those who are assistant editors and all, we will be putting them as trainee editors in international journals,
Right.
Canadian journal, Asian journal and all, so that
Right.
they can be there for 6 months, 1 year, and they can learn and come back and they can work in our journals. These kind of plans are there. Otherwise, it is self-learning from
Yeah.
the books and videos and things
But
like
I feel there should be some eligibility criteria in the future for editors. When they want to contest, there should be something like this.
This I had
Like-
mentioned in my editorial.
Yes, yes.
So,
Yes.
this is even I strongly I agree with you on that.
Yes, yes. Thank you.
Thank you, sir. Usually it is the election process now. In other places it is not like that. It is based on the CV, interview and all, not a democratic process. It should be like editor selection should be like that. Okay, okay.
That should be there for because it's a more technical job.
In South Zone we have at least 2-3 publications, that is there. But at national level even that is not there.
Any certification has to evolve in the future.
Okay,
for all
some
the
sort of
postgraduates,
training.
now we are
Okay.
making two components. One is ATCOM, the training module, and basic research also compulsory for them. So similarly, editors we should involve in the future.
Good idea.
Thank you, sir. I think we'll conclude the session.
Okay, thank you.
Thank you.
I would like to extend my heartfelt gratitude to our esteemed speaker and chairpersons for this enlightening session. And I would like to call upon the stage Dr. Bhagya Reddy sir, patron of the conference, to felicitate chairpersons and the speaker.
Thanks for the opportunity. Thank you.
Thank you. So, good morning, delegates. Our next session is on Research Designs and Biostatistics by Dr. Dennis Xavier, sir. I'm delighted to introduce the distinguished individuals who will be serving as our chairpersons throughout this session. I would like to welcome Dr. Rajshekar Baipeta sir and Dr. Vishal Akola sir onto the stage. Dr. Rajshekar Baipeta sir is a professor of psychiatry of IMH Hyderabad and Deputy Superintendent of Institute of Mental Health. He is also an editor-in-chief of Indian Journal of Psychological Medicine. He is also the Indian Psychiatric Society South Zone. Dr. Vishal Akola sir is professor and HOD of Department of Psychiatry, Government Medical College, Jagitial. He is also a National Direct Council member of IPS, General Secretary of IPS Telangana State Branch, State Working Committee member of IMA Telangana, Vice President of IMA Nizamabad, and Assistant Editor of Indian Journal of Psychological Medicine. I now like to request Dr. Dennis Xavier sir to join the stage through Zoom meeting. I would like our esteemed chairpersons to introduce our speaker.
Thank you organizers for inviting us, and it is a privilege to chair Dr. Dennis Xavier sir's session. I have been closely associated with sir for past around 5 years, and an excellent person, to put it very simple, an excellent researcher and an excellent teacher. So he's an authority in this field, and one person whom I can remember at least up to the level of Dennis Xavier sir is in this particular field is Anand sir from our own state. I think, but very rare to find such people with such in-depth knowledge of the specialty. So sir is actually going to talk about research designs and all that. I don't want to waste time. I request Dr. Vishal to proceed. Thank you.
Good morning all. First of all, I would like to thank the organizers for giving this opportunity. So my co-chairperson, Dr. Rajshekar sir, and all the members. So first, Dr. Dennis Xavier sir, he is working as a professor, head of the Department of Pharmacology, St. John's Medical College, Bangalore, and head Division of Clinical Research and Training, St. John's Research Institute, Bangalore, International Research Fellow, PHRI, McMaster University, Ontario, Canada, 2010 onwards, and worked as an investigator and a coordinator for many research projects, and having more than 70 paper presentations at international level and more than 150 paper presentation at national level, and has more than 200 publications. Great. So I would like to over to speaker.
Thank you very much, organizers and chairpersons, for this opportunity. Can you hear me well? Dr. Rajshekar, am I audible?
Yes, sir.
Okay, fine. I will share my slides and let's get started. You need to enable slide sharing for me, please. Tell the organizers I'm not able to share the slides. Please make me co-host or co-host. Right, while that is being done, I should say thank you for two things. One is for accommodating me, although I was not able to, be there in person. Hopefully next time I will come over and be with all of you in person. I like to meet and spend time with young people. And also thank you to Dr. Shahul Amin, Dr. Sai and others for changing my time. I was supposed to speak later, but thank you for allowing me to change the time. Okay, I'm all set now. Let me share my slides and we'll get started. Is it possible for me to see the can you put the timer on one of the screens so that I'm able to see that, please, as I carry on, as I start off? If not, Dr. Rajshekar, time is 10:25. So I will put a timer for myself and I will get started. I have 45 minutes to speak, correct?
Sure, sir. Okay, sir.
All right, thank you. And if at all, I'm boring, Dr. Rajshekar, tell me, I can stop earlier. Okay. All right. Okay, folks. I requested the camera person if I could see the audience. It is, I've seen the chairpersons. Can the camera move away from the chairperson so that I can see the audience for a little while? Yep, thank you. Much better. Okay, zoom out, please. Zoom out a little more. Okay, so if you can see me and hear me, can you wave out to me? All right, good. So do we have 25 people in the audience? That's all I can see, only 15, 20 people. Dr. Rajshekar, how many people are there in the audience?
Total around 30, sir. Around 30 overall. 50,
Okay,
50,
excellent.
sir. 50, sir. 50.
30 is a good number. It's a minimum number needed for statistical analysis. So we've reached that. So let's get started. Okay, so thank you once again for this opportunity. And yeah, if you can leave the camera there without moving, that would be great. Let me get started. So what are we going to speak about today? Really important things. Dr. Shahul Amin gave an excellent talk on how to get your paper published. And he said, one of the things he said is novelty. Right, and I've listened to his talk a few times, and all his material are really valuable and useful. So PG students, please make sure you get a copy of his slides and keep it carefully with you. So usually publishing your paper is the last step in research, right? Last but one, I would say. Let's not go to the very last step. Is the last step. However, thinking of your research question, framing it correctly, and conducting the research properly, analyzing it, interpreting it, and writing it up. Those are the steps before we get to publishing. So I'll go to the first part. Dr. Shahul Amin did the latter part. I will do the first part. How to ask a research question. What do we mean by aims, objectives, and hypothesis? What are the commonest research designs that you people need to know? We have observational studies such as cross-sectional, case control, and cohort. Then we have interventional studies, so they're also called randomized controlled trials. And then very briefly on biostatistics, I'll speak about what do we mean by descriptive statistics and what are the meaning of inferential statistics. Excuse me. We look at types of data, distribution and dispersion, and the most common parametric and non-parametric tests. If you sleep through the entire part and you want to wake up, this is the time to wake up. How to find a statistician and how to work with a statistician, right? And finally, stay awake because I'm going to give you very valuable points on how to do research as a postgraduate student. The other parts, these parts, you can learn from anywhere. Oops, sorry, my line has gone off. These parts you can learn from anywhere, but these two are, I would say, novel and valuable thoughts for you to keep in mind. Okay. So what is research? Very basic question. I will use the first two letters of the word research itself to give you a very simple definition of research. Research is asking a relevant question. Relevant also means novel. It's also useful for a large group of people. It's a relevant question. You ask that question and you answer it reliably. Can you see this? Relevant question and answering it reliably. That's all research is about. Now, before we do something, we need to ask the question correctly. So I'm going to give you the components of asking a research question. I'm not going to give you my slides. So pull out your phones and take pictures of some of these slides. Okay, I'll tell you, take a picture of this, then I will, okay. So parts of a research question. Right? This is from a definition in 1997 by Dave Sackett and others. We can abbreviate it in the following five components. PICOT. P stands for population or patient, or even better, participant. Don't use the word subject. You don't want to subject people to research, you want them to participate in your research. Right? So population, patient, or participant, not subject. I is intervention. However, in observational studies, there are no intervention, or you can say, what am I interested in? I'm interested to find out how much of a disease there is, what caused the disease, what is happening to the disease, right? It's observational. So, what am I interested in? C is a comparator, O is the outcome in the study, and T is the time for which you're going to do that study, which is in cohort studies and randomized control trials, you have a period of follow-up, that is the time. What are the different categories of questions one could ask? How much of a problem there is? Burden. what has caused the disease? How do I diagnose the disease? How do I treat it better? Or how do I even diagnose it better is also an intervention, right? How do I treat it better? Or even before that, how can I prevent disease? Or how can I prevent complications? How can I cure disease or control disease is intervention? And finally, prognosis. What happens over a period of time? Paranoid schizophrenia, right? How much is there? What has caused it? There are so many things now, right? From environmental to genetics to so many things. You people know that better than me. How do I diagnose? What can I do to improve it? And what happens over a period of time? If you treat, if you don't treat, etc. Template for a cause. Let us look at it as PICOT. Okay. Template for a cause is, do people who have a particular risk factor, that is what I'm interested in, compared to those who don't have a risk factor, more likely to develop depression, more likely to develop OCD, whatever, right? Do people. So this is template for a cause. Similarly, template for diagnosis. Among people with a particular condition, what is the diagnostic accuracy of a particular test compared to a new test or rating scale that you have in detecting a particular outcome? That's for diagnosis. For treatment, among people with a particular condition, does one particular treatment, drug A compared to drug B, reduce complications or improve quality of life or reduce the scale, etc. So that is template for therapy, and similarly for prognosis over a period of time. Okay. Now these three questions or these 3 points here, aims, objectives and hypothesis. Sometimes people add another part called goals, but we'll leave that aside and then just look at these 3 words which are important. Aims, children, that is your lifetime ambition, right? But how do I do it? I do it step by step. And those steps are objectives. Those steps are objectives, and we can look at these objectives with these 2 acronyms which I will show you in the next slide. Hypothesis is a statement tested by experiment, and you will usually write this hypothesis along with a statistician. So for now, you don't worry too much about hypothesis. And unfortunately, most doctors go and listen to lectures or talks, and if a statistician is giving the talk, they will start off with null hypothesis and alternate hypothesis, etc., and then people get put off. Okay, so let's continue on with objectives. Could you tell the camera person once again to show me the audience, please? I like the chairpersons, but I don't want to only see them. So tell the camera person, I like to see the audience when I'm speaking to them. Yeah. Maybe Dr. Rajshekhar, audience along with the, okay, right, yeah, leave it like that. Yeah, okay. So here are the 2 acronyms for how to write the objective. SMART and FINER. SMART is specific, measurable, achievable, relevant and time bound. And FINER is feasible, interesting, novel, ethical and relevant. More or less both are the same, right? But there are a few new points here and there. So once again, take a picture of this, and when you're writing your objectives, right, make sure these components are there. Okay, one more thing, let me tell you. I don't see people writing notes. I hope you have a book or a paper or a pen with you to write notes, because the next one I want you to write down. When you write objectives, you start with the word to, TO2, followed by a technical verb, VERB, verb. It's an action verb. To assess, to estimate, to measure. Okay, these are words that we want. It's not there on my slides, so write this down. That is how to write objectives. People write all kinds of nonsensical stories with objectives, and then you don't write your objectives, you don't achieve them. Okay, question to hypothesis. Research question guides the study design. We're going to write the study design. We're going to look at study design shortly. Hypothesis is how you do the statistical analysis. So that is why I told you this you work with a statistician, but this you need to know by yourself. Okay, types of objectives. Primary objective is the main question you want to answer, and it is statistically powered. Secondary objectives, they are also important. You gain more knowledge with that, and it need not be statistically powered. They are also called exploratory objectives. All right. So these are the 2. Then there are tertiary objectives. Let's not go to that. We are going to keep this simple. Okay. Now I'm going to go to study designs. Now each of these study designs is 1 or 2 full lectures, but I'm going to give it. This is going to be a short trailer, not even a regular trailer for a movie. It's going to be a short trailer, and you're going to get a feel for this, and I'll try to keep things as simple and as clear as possible for you. Okay, if you look at all the different study designs, there are so many, right? Basic research, clinical research, epidemiological research, secondary data, and see, so many things are there. Okay, and I can spend the next 2 hours teaching you all of this one by one, but let's keep it simple, right? And we want to find out the commonest and simple research designs. Okay, first you ask a question: did the researcher or investigator assign an exposure? Exposure simply means, did they do something? Did they change something, right? Including change a diagnostic test or give a particular new treatment. So that is called an exposure. All right. If yes, it becomes an experimental study. I am trying out something new. On the other hand, if it is no, it's just an observational study. That means I am observing what is happening. And for PG students, you must focus primarily on observational study. Later on, as junior faculty, senior faculty, or senior consultant, then you can go on to interventional studies. People are all fascinated with randomized controlled trials. All of that we can do later. Generally, some universities do not allow postgraduate students to do experimental studies or randomized controlled trials. And the simple reason for that is their guides will be influenced by some pharma companies to try out some medication, but they'll tell the PG student to do it. They get spurious results, and then they try to publish it. Right? This is why some universities do not allow PG students to do interventional studies or trials on medication. So when you're learning research, please learn the observational study design. So here, just for us to understand different study designs, let's look at experimental studies. First, in the experimental study, is there random allocation to 2 or more groups? If yes, it is a randomized controlled trial. You have heard this enough and more. Even as an undergraduate student, you would have heard it. If there is no random allocation and it's still an experimental study, it's called a non-randomized trial. Okay, we'll not worry about that now, right? We'll go now to observational studies. In observational studies, do you have a comparison group? Yes or no? If yes, it becomes an analytical study, otherwise a descriptive study. Many people call an observational study as a descriptive study. No. In an observational study, if you don't have a comparator group, it becomes a descriptive study, and those studies are of no value. So don't go and do a descriptive study. Always have a comparator group so that you can answer a question, right? An analytical study. Based on the direction the study takes, it can be any of three. One is called a cross-sectional study, where exposure and out, it's at one time, it's like a cross-section. At one time you're going, and then you're collecting data from the patient, and that's all. You're not following up the patient. This is a cross-sectional study. A case-controlled study, an outcome has already occurred, and you're going backwards to find out what risk factors caused this exposure. What risk factors, which is the exposure, caused this particular outcome, and you want to compare it with people who don't have the outcome. That is a case-controlled design. And a cohort study is you collect a group of people, you measure their exposures, and you wait for outcome. Can you see this going forwards? And this is going backwards. Okay, this is from a 1992 Lancet paper. It's an old paper, but classics. Okay, so I like it because it is so simple. Right? All right, so let's move on now. Why do we do so? So let's go back and look at each of these study one by one. Cross-section study, case control study, cohort study, and a randomized control trial. I'm going to give you a very brief overview of these studies. Okay, why do we do cross-section study? To find out how much burden is there, how much of this disease is there, what kinds of people are getting this disease, right? How severe is the disease in that population, right? Older people getting more disease, younger people getting more disease. So it's a simple study that way. Also, we can estimate the strength of association of the risk factor or factors, multiple factors you can have, right, to the outcome, right? So initially in the 1960s and 70s, they looked at, smoking and cancer outcomes, right? They looked at that. Anyway, so we generate hypothesis, but you cannot give causation. You cannot say this particular exposure caused this particular outcome. Okay, this is how a cross-sectional study is designed. Study exists at only this point in time, at one point in time. You have the study population. Some of them have no disease, some of them have the disease. So you can go, let's say, to your entire OPD population and find out how many of them have depression, how many don't have depression. Or you take your entire OPD, not just psychiatry OPD, the whole OPD, and find out how many have mental health issues, how many don't have mental health issues. Among them, let's say for example, psychosocial stress, right, could be a factor. Some people will have it, some people will not have it. People with psychosocial stress, some of them will not have depression. The other people with the disease, some people will have psychosocial stress, some people will not have psychosocial stress. Okay, so you can now analyze this and interpret it. There are biases in case control study design. The two commonest biases. Bias simply means, for us, you're not able to discern what has actually caused this. Okay, so or you are systematically getting the wrong data. That is called a bias. We have two types of biases. One is called recall bias, and then the non-responder bias. So you have to design the study well and ask the questions in such a way that these biases are minimized. People think cross-sectional studies are simple. Yes, they are simple, provided you deal with the biases and also you sample your cases well. You sample your cases well. There are two types of sampling. One is called probability sampling and the other one is called non-probability sampling. We can spend the next half an hour discussing this, but we don't have time for that. Therefore, I'm going to tell you that only use probability sampling. And I'll tell you the types of probability sampling, and you need to keep that in mind. One is simple random sampling. Then we have systematic sampling, and you have stratified sampling. I would recommend you all to read up more about these two and try to use these two sampling methods. Then you finally have clustered sampling. As a PG student, you are unlikely to use clustered sampling in your studies. Okay, so take a picture of this, those of you interested, and read up more about simple random sampling and stratified random sampling. Simple random sampling, I'll just very briefly explain this to you. You have a system by which, suppose you have 100 patients in your OPD, you want to take 30 of them, you don't take the first 30 or the middle 30 or the last 30. A simple Excel program, you go to Excel, you ask Excel from 1 to 100, give me 30 random numbers. It will give you those numbers. Those numbers you can go and pick up. So it will give you something like 3, then 7, and then 12, 15, 17, 21, 33, something like that. It will be totally random, 30 numbers it will give you. Those numbers you can pick up. Stratified, you divide the population into strata, age, sex, disease severity. These are three commonest strata. Based on that, you collect your sample. Alright. Non-probability sampling, not to be used, but most times people use this. They do convenience sampling and then they call it random sampling. Then a journal editor will catch you. They'll ask you exactly how did you do your random sampling. Then there's something called quota sampling, purposive sampling, snowball sampling. These are all okay, valid methods of doing it, but they all have limitations. But I would recommend you to read up more about probability sampling and use that. How do I analyze cross-sectional studies? Now keep in mind, all factors are measured simultaneously and we compute the odds ratio. So for cross-sectional studies, it is odds ratio. So you will have, of course, percentages and all of that, that is fine. Then you will get an odds ratio to estimate whether this how strong is the association of the risk factor with a particular outcome. Okay, let me give an example of one of the first papers that I published called the CREATE registry, and this was published in the Lancet in 2008. We looked at the treatment and outcome of acute coronary syndromes. It is called a registry. First we do a cross-section study, then we follow up patients for some time and we do different kinds of analysis. That's why it's called a registry, but primarily it's a cross-sectional study. Okay, so what did we do? We collected 20,937 patients from 89 cities across India, right, and we followed them up, right? So this part of it, okay, up to here was a cross-sectional study, right, and then we followed them up, some of them, right, to get the registry data. Okay, so I'll skip this part and tell you this is the media coverage of this particular paper, right? You can see BBC, you can see China Post, you can see where is Manila Times, this is NASDAQ, the Wall Street Journal, Heart.org, MD Consult. There were 3,600 hits on Google within one day, because I'll go back and I'll tell you why. Because this is the editorial that Kim Eagle wrote from Michigan in the US and said this registry is a major milestone. It provides the first comprehensive view of the epidemic of acute coronary syndromes in India. A problem well defined is half solved. Then they say that the authors need to be commended for whatever, and then they give the next obvious steps. So this is a very good editorial that was written, and that's how even a cross-sectional study like this can have a very high impact. Okay friends, with that let's move on to a case control study design. Here the disease has already occurred, okay, and you find the person with the disease. That is very easy for all of you, because people with the disease, they come chasing after you. That is easy. So you get consent from them, and then you collect their data backwards. Okay, let's say if you're interested in, suppose you have a hypothesis that depression is associated with smoking. So you start asking that person smoking history. Let's say this person is 60 years old. That person will give you history from the time he or she was a teenager. Let's say he was a teenager when they started smoking.